like you always say, they address your emotional health, your mental health, and others, including spiritual. That always makes me chuckle a bit. But well, we are back. Like I said, we have a very important interview right here, a concept that a lot of people would attribute to village people. We are trying to, clear the myth on several issues. Today we'll be focusing on managing and living with cerebral palsy, and Dr. Gabriel Nwala, a regular here, our own regular, is right here in the studio. Thank you so much for joining us. Dr. Nwala is from the Limi Hospital, Abuja. It's always wonderful for the work you people do in creating awareness on certain issues like this. At least we know that cerebral palsy is an unwelcome global phenomenon. And there's a day we celebrate the World Cerebral Palsy, which is on the 6th of October. It reminds us that 17 million people are impacted by this disorder. It is called here. It is one of the most common physical disabilities affecting the most vulnerable amongst us, which is children. Additionally, CP occurs over the span of a child's entire lifetime, with no cure. However, there are ways to improve the lives of those living with it. That's what we would be discussing. And Doc, it's always wonderful to talk about these issues that a lot of people, would very quickly wave aside and say, oh, your own is finished, this child was attacked and all of that. So I'm happy to be here to, address this myth. First of all, welcome.
Thank you.
Today we are, celebrating globally a day set aside for this. So beyond what I have just said, just give in a more relatable form to people listening to us what cerebral palsy is.
Okay, so let me try and water it down a bit so that a common man out there will be able to understand what cerebral palsy is. Now, there are a group of conditions that are characterized by abnormal movement, gait or posture that resulted from what we call aesthetic lesion in the brain. Okay. Now, while the child's brain is still developing, whether while still in the womb, at birth, or within the first 3 years of life, any insult that happens to this developing brain can actually, the insult might just have happened and is no longer there, but as the child grows up, you now start seeing some manifestations of what the brain function of that child would have been,
right,
if there was actually a kind of lesion that happened while the brain was still developing. So you find children that are unable to sit when they should sit, unable to crawl, unable to stand and walk within the timeline, all those things should have been achieved. So it might also impact in the child's ability to communicate, to speak. So once you have those developmental delays that can be traced to a problem that happened while the child was in the womb or within the first 3 years of the child's life, one can say that such a child has cerebral palsy.
Okay. Now, what would you say the prevalence is in Nigeria, for instance, or in Africa?
Okay, so in there are actually paucity of data. A number of people have tried to...
Is this same village people phenomenon?
Okay, so
is that why it's causing the paucity of data?
So many people don't even deliver at the
conventional hospitals or clinics,
hospital settings. So if somebody has a home delivery and the birth is not registered, one cannot really account for the events that transpire within that perinatal period. Now, having said that, the few cases of cerebral palsy that have been documented most times are hospital-based documentations. Those that came to the hospital, not like a community-based survey. So in developing countries generally, the incidence has been, reported to be between 1.5 and 5.6 cases per 1,000 live births. So now, out of 1,000 children that are birthed now, about let's say about 5 in 1,000 of them will have cerebral palsy. That's in developing countries based on data that has been documented. While in developed countries, that's civilized countries, the incidence is between 2 and 2.5
for every 1,000 births.
1,000 live births in developed countries. So we can see from here that there is actually an overlap.
Right.
You can't really say it's commoner in developing countries, because when you're looking at 2 to 2.5, you're also looking at 1.5
exactly.
to so it cuts across all climes, whether developed
or not,
or developing. However, in all these settings, one thing that is common amongst those that have children with cerebral palsy is low socioeconomic status. There are people that are financially constrained, both in developed and developing countries. Developed countries have high earning and low income areas. So those that are low income earning may not have the access to quality healthcare, and may not get the best when it comes to all the things that should be done to prevent the incidence of this. So that's it's what has been documented regarding cerebral palsy.
Now, are there lifestyle protocols that endangers the fetus or the child more than others, apart from, I mean, you just mentioned the low income state, but are there lifestyle protocols really?
Okay, so 70 to 90% of cases of cerebral palsy derive from what we call congenital anomalies, problems that started in utero. Now, a pregnancy that is not well monitored might actually progress to the point of birthing without one noticing some of these problems. If there is congenital anomalies of the brain, if there are intrauterine growth retardations, if there are things that impact negatively on the developing child. Now this can actually now manifest as delayed development that will make one narrow down the problem to cerebral palsy. So in settings where there is good access to healthcare, some of these things can be spotted and corrected. A child that is not growing well in utero can be picked up in the course of antenatal. The fundal heights, as the measurement of the size of the abdomen of a gravid mother, can actually show that this child is not really growing. Then some ultrasounds and other things can be done to identify what the problem really is. If it's something that can be corrected, let's say the woman's blood pressure is very high, and due to poor blood pressure control, the child is not growing well. Now the BP control can be improved upon, so that this child can get adequate nutrient supply in utero and not progress to have a delayed growth. That is one of the risk factors. Another thing is prematurity. If a child comes out before 37 completed weeks, there's also the risk of bleeding into the brain. So if there is bleeding into the brain, that can actually cause a lesion, the static lesion I mentioned, that will now manifest as a delayed development, which can affect the muscle tone, the gait, or the posture, which will now tag as the child having cerebral palsy.
Now, can you develop it later in life, or can it get worse later in life? Because you keep talking about the fetus, the children, but I've also, I think I've stumbled on a report that the person thought he was okay until he started dwindling, his movement started dwindling. I know, is it possible?
I try to, give it's actually a spectrum. The problem can start while the baby is still in the womb. The problem can also start within the first 3 years of the child's life, because by 2 years of life, 80% of the brain has formed. So while the brain is rapidly developing within the first 2-3 years, and something happens like a CNS infection like meningitis, encephalitis, and all, such infections can actually affect some neurons in the brain. So when it heals with some scarifications that, destruction of some of these nerves, such that the function that the nerve should have helped the body achieve, you now find as the child grows, you now find that the child won't be able to, demonstrate such, capacities like being able to stand
well, right?
All these things are actually things that the brain controls. That is the seat of power, as it were, controls. So once there is any problem up there, you now start seeing the manifestation. Now, the manifestations can be progressive, but what is causing it is non-progressive. So some people define cerebral palsy as some of the disorders of gait, posture, movement, from non-progressive lesion in the brain, in a developing brain of a child. So the problem that causes cerebral palsy is a lesion that is static. The lesion is not, worsening. It's just there is something, is an insult that happened while the brain is still growing. So you might find a child that came out normal, had normal development within the first maybe
1 year,
right, and now has an infection that is poorly treated, like meningitis. You see an infant that has been spiking, maybe the caregivers are doing a home remedy, buying medications they don't even know,
and it is oh my goodness. And so that's right now is our reality back here.
So now, as the child is being treated for malaria, for instance, and maybe there's an infection like meningitis, so this infection continues and continues damaging the neurons in the brain. So that destruction that happens leaves a scar that, as the child might just get well and all, but when you expect the child to stand, let's say around 10 months, you expect the child to be standing. By 1 year, you expect the child to be walking. Now, at this period now, if you notice that the child is still struggling to sit down, it means that there is delayed gross motor development, which may, rouse the suspicion of the clinician that this child may have cerebral palsy. You now start asking questions around the, from the time of conception to the first few months or years of life. Then you now find that the child had a fever, a very serious infection that they never visited the hospital for. And probably, maybe some will even get to the hospital, treatment is commenced, and maybe due to maybe sentiments, I don't want to sleep in the hospital, I want to, stay in the comfort of my home. Now, you have parents sign against medical advice and take their children home without getting properly treated for such invasive infection. Now, as this child grows up, you now find that some of the things that his or her mates are doing at some certain ages, the child is unable to do them. So that's, I don't know whether
I think that's a good one. But let's, I mean, while speaking about the cure for it, I mean, it said here, I did some research, there is no cure. However,
okay, so saying that there is no cure, well, medicine is dynamic.
Right.
Now, depending on the severity of the affectation, now a child might just have a mild cerebral insult that within a very short time, interventions are offered. Now, unless somebody tells you that this child had, let's say, prenatal asphyxia, and within the first 10 minutes of life, the resuscitative measures are offered, the child may not necessarily manifest with severe motor or movement disabilities, but that doesn't mean that the child didn't have
it exactly.
But there are some that will keep their kids until when, like, the child is way above 2. By the time more than 80% of the brain
has developed,
they now present to the hospital. At that point, you're not just managing the problems of movement with physiotherapy and the rest. The child may have even manifested learning disabilities. Some may have even started convulsing, epilepsy. Up to 30 to 50, 50 to 60% of them have epilepsy. They're having these seizures.
I was going to ask, because that's another question, so right there.
Some, like 30 to 50%, have intellectual disability, previously known as mental retardation. You see a child that is just behaving, let's see, you see a 4-year-old behaving like an infant. So the mental age is way lower than what you expect a 4-year-old to be doing. So these are some of the things that with early intervention, the child may not even manifest. But that doesn't mean that such kids don't have cerebral palsy. I remember during my residency, when we see children with cerebral palsy, we actually, from the reception, you know that this one, the way they walk, drooling saliva and all that, most of them present during adolescence, when the parents are already overwhelmed. They can't really be
managing easily,
bathing children, adolescent children, helping them wear their clothing, helping them move around, use the convenience and all that. It can be overwhelming. And the bigger these children get, the heavier.
Of course.
So you see a couple that are already advancing in age, carrying
20,
children that
30
are
year
more
old.
than one bag of cement and all that. So it doesn't really. But I've also seen those that sought for help early, and how the outcome ended up being. So it can actually be, the outcome can actually be good. And there are newer therapeutic interventions like stem cell gene therapy and all that can actually help in some of those neurons that were affected by the lesion, by the insult, can actually be new cells can actually be put in place to replace them, and you find the child
improving.
So there are a lot of things that are done nowadays that can.
Are those things available to us and accessible?
Well, the thing is, healthcare is quite expensive. Those that have the wherewithal, that are really well motivated to get results, actually go for them once they have the muscle, the financial muscle to, go for them. But, majority of our populace, people are looking for
three. No, these days they say that it's no longer 3 square meal.
A good quality meal is an issue. So I don't know how many people
would be able to afford stem cell
to now start going for those.
But do we have support and management facilities in country, in Nigeria?
There are a lot of, at least for us now, we should, since we may not have those, both the economic wherewithal to go for all these advanced therapies and all that, preventive approach should be encouraged. Now, there are a number of things that our parents, our mothers out there can do to even prevent the child coming down with the cerebral palsy. Good antenatal, care, not just going for antenatal where you just sit and buy all the things, these cravings of pregnant women. So you actually benefit from the health education, the health talks that are being, offered in the course of the antenatal. You also keep your appointments, ensure that your pregnancy is properly monitored, and you trust your healthcare givers, to make some decisions that can help you ensure that your baby doesn't come to any harm. For instance, if you don't have a ruby pelvis now, to have normal
what
delivery.
does a ruby pelvis
okay mean? So there are women that may not have their hip bone may not be wide enough for babies to come out, and if these babies are bigger than those passage now coming, the baby passing through such a
narrow
this might not be very swift, and the longer it takes for the baby to come out during labor, the more likely the child might end up, the mother might end up having what we call obstructed labor. Now, if there is obstructed labor, the child will be asphyxiated. The child won't be able to initiate and maintain respiration after delivery. And that is one of the common causes of cerebral palsy, some of the acquired causes of cerebral palsy in our environment. Now, if they trust their obstetricians enough to make decisions about the safest mode of the fastest and safest mode of delivery, whether it's abdominal or whether it's spontaneous vertex. Once the baby comes out when he or she should come out, there won't be problem of poor cry at birth, and there won't be any cerebral palsy. So another common thing that can result in cerebral palsy in the environment is what we call neonatal jaundice, yellowness of the eyes, skin and buccal membrane. Some people still engage in practices of exposing the child to early morning sun.
But now, hold on, isn't that the vitamin D we
no, this one now, the sun now has a wide spectrum of what we call wavelength of lights now. Now, lights in the blue and green spectrum of that white light is what is beneficial. Now, you're exposing the child to all the different spectrum, and the child is not really as effective as when you expose the child to the specific wavelength that will bring down the jaundice level. And another thing, if you're doing the exposure on your own, there's no monitoring.
You don't know when to stop.
So is it coming down? Is it going up? Because if it's done in a hospital setting where you properly monitor the progress or the retrogression of whatever you're doing, other interventional measures can be applied. Let's say you're doing phototherapy and it's still going up, because there are some causes of jaundice that cause rapid increase in the jaundice level, like ABO incompatibility, pre-suicide immunization, and so many other things, GCSPD, neonatal sepsis and all. So if the thing is causing this rapid progression is not arrested, and the level keeps going high, the child might end up having acute bilirubin encephalopathy that will lead to some neuronal injury that will now manifest as cerebral palsy, chorioatytoid cerebral palsy later in life. So this is something that we can do. Once the risk of jaundice is there, let's say the mother is O, the father is A, B or AB, and the baby picks up father's blood group, there could be some disagreement between the maternal antibodies and the child's red blood cells that will cause jaundice. The same thing happens in rhesus. So in the course of your antenatal, perinatal, this thing, some of these questions are asked. Mothers that are rhesus negative are given program to help prevent some of these things. So if all these things are not properly identified and handled, the child might have several problems. Another thing is infection. Every fever is not malaria.
It's not malaria. I think we should start a campaign. So every fever is not malaria.
It's not malaria. Even though malaria is endemic in our environment, it's common. But there are children that might have fever from other causes. And if the cause of the fever is not properly, identified or diagnosed, then we might just be giving all
sorts of malaria drugs and oh my goodness.
Give the second one, give the third one. Then you've kept this child for up to 1 week, 2 weeks with fever. Then you now present to the hospital. By the time you come to the hospital, the problem, the lesion that will eventually lead to cerebral palsy has already happened. And one will now start looking for how to support these children, which could have been prevented.
So do we, I mean, in our setting, I know that medical experts like you are still struggling to get people comfortable enough to come, especially when it comes to birthing. There are traditional birth attendants that they will swear do the best jobs and all that. So how is the awareness level like? What's the reception when you bring this information to them? I mean, I know beyond the media tours that I know Limi Hospital is very rife on that. What's the reception when you meet with these people during initiatives and you say, you know what, get to the hospital for proper monitoring? So it does. There are several other things that could go wrong during birth that your traditional birth attendant cannot necessarily handle. Right.
So I actually like the platform Aso Radio TV has provided to raise awareness. I know that anybody watching from far and wide
now knows,
will, beyond just knowing the right thing for themselves, they will equally be better informed to also advise their relatives and their friends. All right. So this is one of the things that needs to be sustained. Now, in addition to this, there is also that notion of people. There are a lot of people that healthcare is a serious business. There are people that don't have any business offering any medical advice. Now, your neighbor that is not a doctor, is not a nurse, is not even a healthcare personnel, advising you on what to do and what not to do regarding your health. And this might be opinion leaders, this might be well-respected people within the community, this might be mothers, grandmothers, and all that. Now, if very easygoing people take these pieces of advice and now these people do what they've been advised on, there might be problems. So people should be able to look for right information from the right sources.
Right.
There are a lot of people that are still doing all these herbal things. People give you're told to take this, that it cures everything.
Yeah.
Let's say a woman is pregnant and has blood pressure issues. Instead of going to get antihypertensives that are beneficial or useful for somebody that is pregnant, it's not every antihypertensive that you should take. So instead of going to see a professional that will advise you on what to take and properly monitor this blood pressure, you're taking a book that will bring down blood pressure and all that. So beyond just the blood pressure issue, the person now starts having renal and liver issues, from the failed attempts to detoxify some of those harmful things. Then the traditional birth attendants now, it's true that those days when we didn't have all these luxury of hospitals and all that, there were some of them that were serving the communities and all that, but a lot of people died during that period. That's just the truth. You know, if you actually take some, you know, statistics from that period, you find that a lot of unnecessary deaths happened during that period. And even in our today world, they may not know their limits. They may not know high risk. They may not be able to identify high risk pregnancies. Pregnancies that, let's say, a woman had delivered initially via cesarean section and takes in again, and maybe just doesn't like the notion of delivering abdominally.
Yes.
And any hospital she goes to, because she has had a CS before, there might be a very high chance that it will be suggested that so she now goes to somebody that will say, okay, let me just try. Now, as the person is trying, there is no way to monitor when the womb ruptures and this woman stays in labor for days, baby is not coming out, maybe the womb ruptures, and you now package a near dying woman to the hospital. You're battling to save the life of the mother. The baby may have even, you know, gone, or may have been asphyxiated already in utero. Baby comes out, has cerebral palsy. Mother, you know, some may not even survive it.
Wow.
Some may survive, and by the time they come out with the womb that has ruptured, the womb might be removed to save the mother's life. You know, that means she can't take in again and all that. So these are things that people should realize, come to the realization of, and make informed decisions when it comes to, you know, deciding where to go for their antenatal care. So that the incident over the past 4 decades globally, the incidence of cerebral palsy has not changed.
Wow.
It's not going up, it's not coming down. The same problem of people not doing the right thing is still there. The same mindset of, you know, I don't want my wife to be attended to by maybe a male doctor. I want a female and all that. Some will even go to maternity homes so that nobody will see all those, which they're not even thinking of the life of these women. They're not thinking of the, you know, the outcome of the pregnancy, as it were. Because if the baby comes out with cerebral palsy, you know, the whole journey of 9 months, the stress of carrying the baby,
stress will not even have ended at that time.
You know, so, you know, it's not.
Now, talking about awareness, I don't know if this is within your space to have this conversation, but it also concerns me. I mean, I have a cousin who is supposed to be educated. She was ill at some point, and I was like, oh, what did the doctor say? She said, no, I have a nurse who has prescribed something, you know. So I told my mom, who is a nurse, by the way. My mom was like, okay, let me have a conversation with this nurse. Let me know why she thought with these symptoms you have presented, this is the drug you should take. It turns out this lady learned chemists, that's what they call them. They're apprentice in patent medicine vendors, yeah. But I like to call it chemist because that's what's relatable.
When you say chemist, it means that the person has done maybe chemistry school.
That's the local parlors. I mean, yeah, but that's it. She was an apprentice and she graduated in the patent medicine vendor business, and that's what she finds as qualification to be a nurse. And in that entire place, she's been prescribing. Everybody comes to her for this prescription. Whose job is it to ensure that this stops? Because we're not now talking about the local traditional, birth attendants or the traditional herbalists. We're talking those who have some level of education.
Learning how to sell over-the-counter medications, doesn't really confer one with the capacity.
But that's the problem, Doc. They go beyond over the counter.
No, for somebody to even know that this is, in communities, there are community pharmacists that if you need a pharmacy assistant and all that, they need to work under pharmacists,
right,
professionals that have already studied both the pharmacodynamics and pharmacokinetics of medication. Which medication should be given, which ones can interact with
right,
who should actually prescribe this kind of medications and all that. There are medications that you don't expect a general practitioner to give. There are prescriptions specialists actually give, and there are prescriptions you don't just give and tell the person to go.
Right.
There are, you actually keep them in the hospital and monitor, so that if there is any untoward effect, you know how to, reverse it and all that. So when it comes to health, it's only in this part of the world that you have those kind of things. Nobody is monitoring what is happening. These people are in the communities where people's level of education is quite low. Now somebody that is properly educated will know that everybody has a role. If I want to make a suit, a jacket now, I will not go and meet an electrician and say, please, can you fix
quickly
good jacket for me? It wouldn't make sense. The person will just use wires and join and all that. So it's only in this part of the world that your health that should be taken seriously will be left in the hands of somebody that is not trained. And you know what it means. It means that there will be lots and lots and lots of problems along the line. Some people may not even survive it.
True.
Some may survive with some level of disability and all that. Before some people will come to the hospital, the problem may have gotten so complicated, and you need to bring them out of the complication, stabilize them before you now say, okay, what is the primary cause of this problem, and now start handling the primary problem. So it's something that anybody listening in should actually also lend his or her voice to this campaign, for our people to do the right thing. Ensure that anything that concerns your health is handled by a health professional. There are different facilities out there that you can get quality care from, and by the time you get this quality care, you actually prevent some of the problems that can result from poor
treatment or handling
decisions.
Right.
Cerebral palsy is something that from this our own side of the globe we can work on reducing the some of the risk factors that lead to the condition.
Thank you so much, Dr. Wala. It's always wonderful to come talk about these issues. But before you go, what's your encouraging statement to those who are managing patients, those who have this CP?
Okay, so that a child has cerebral palsy doesn't mean that the child's life should not be meaningful. With these awareness campaigns that we are raising, it's expected that everyone out there lends their support to encourage these children have a meaningful and good quality of life. There are a number of things that can be done to support them and to help them. Things like for those that are still unable to ambulate, physiotherapy can help ensure that they are able to move around, able to engage in the events of daily living, wearing, dressing themselves up, undressing themselves, bathing themselves and all that. These are things that can be achieved when physiotherapy is offered. Now, those that may have some level of intellectual disability, there are some things that can be done to also help them, you know, at least anything you're doing for them, you come down to their level of understanding so that they are carried along. You know, those that are having, you know, epilepsy, anticonvulsants can be given. Now, with anticonvulsants, there won't be any abnormal, you know, jerks and all that, which can also help them, you know, have a good quality of life. So everybody, once all our hands are on deck, will be able to help children with cerebral palsy achieve good quality of life.
Thank you so much, Dr. Gabriel Mwala. It's always wonderful. Thank you again. I know I'll see you soon, because these days that create awareness for some of these ailments, you're always on point for it. Thank you.
Thank you for having me.